It is my immense pleasure and my honor to welcome all of you here, all the dignitaries who have come far away, especially to make this event a very successful.
I would like to invite our first eminent speaker, no other than Dr. Rosy Gundra. Dr. Rosy Gundra is the esteemed proprietor of Nissi Handicrafts and director of Sankalp Foundation, a thriving enterprise based in India. With a master's degree in social work, MSv, and over 11 years of invaluable work experience, Dr. Kundra exemplifies dedication and expertise in this field. Dr. Rosy Gundra will be sharing her research on the study of mental health of rural adolescents. Please make welcome with a round of applause, Dr. Gundra.
Good evening, one and all. Representing India, thank you so much for giving this wonderful opportunity. Early adolescent is the period of emergency of most mental disorders, contributing significantly to the mental health burden globally, including India. The major challenges in India are early identification of mental health problems, treatment gap, lack of professionals, and interventions that address the same. Our review aimed to access to effectiveness of mental health interventions among adolescents in India. 11 interventions were included in this review. 9 were school-based, 1 community, and 1 digital. Most of the school-based programs use a life skills curriculum. Additionally, coping skills and resolution co-curriculum activities shown implemented in depressive systems, cognitive abilities, academic stress, problem solving, and overall mental well-being. The multi-component whole school intervention was quite promising and helped in improving the overall school climate and various other mental health outcomes. Hence, school-based program should be implemented as an early point for screening mental health problems. However, there is a need for a more comprehensive mental health program in the country for adolescents. Additionally, there is a need to address the gap by conducting more interventions by early and out of school adolescents. Mental health is fundamental to good health and well being, and it influences social and economic outcomes throughout life. Childhood and adolescent are crucial for laying a fundamental for healthy development and good mental health. The increasing burden of mental health problems among this population is a growing concern globally. Most mental disorders being before 25 years of age, more often between 11 to 18 years, the burden associated with common mental disorders rises in childhood and peaks in adolescence and early to middle age 10 to 29 years. Multiple factors are associated with poor mental health among adolescents, including domestic violence, child abuse, peer pressure, substance abuse, human HIV infection, and teenage pregnancy. Transition through stressful and unhealthy adolescence with a high burden of mental disorders can make their health and well being later in life. Hence, investment in adolescent delivers a triple dividend, improving their health now, enhancing it throughout life, and contributing to the health of future generations. India has a national mental health program which functions at the district level and is also working towards delivering mental health as a part of interventions primary care within the public healthcare system. The government of India has also started the National Adolescent Health Program, which has mental health as the priority area. Still, there is a huge gap in addressing the mental health needs of adolescents, and unfortunately, the situation has serious since the COVID-19 pandemic. This it makes a crucial case of take mental health at the forecast of the issue that needed to be addressed. The lack of mental health programs for adolescent in schools and outcome of schools adolescent in India may be due to various challenges such as problems in conducting school-based psychological programs, adolescent stigma related to mental health problems, and lack of qualified mental health workers. With the COVID 19 national lockdown, adolescents have gone through acute and chronic stress because of parental anxiety, depression of daily routines, increasing family violence, and no access to paid teachers and physical activity. We have taken some studies like peer group. So here, a peer-reviewed article published in the last 10 years and reporting interventions that target adolescent mental health work were included. In addition, we included studies that targeted adolescent 19 age group. We decided up to a scooping review due to two reasons. First, we had a budget and human resource constraints for a complete systematic review. Second, adding 10 years to the search filter may not have given us recent evidence. Types of studies, programs, interventions designed to promote, improve positive mental health among adolescents. Outcomes. The primary outcomes of interest were mental health and well being benefits, including indicators of positive mental health such as self esteem, self efficacy, coping skills, and emotional well being. Negative mental health such as depression, anxiety, psychological distress, suicidal behavior, and well being such as social participation, empowerment, communication, and social support. Objectives of this study is a majority of the school health interventions in the review focused on different life skills, education programs, life improving adolescents' well-being, including coping skills programs, life esteem, academic stress management, self-awareness, adjustment, motivation, internal lossy of control, and self-determination, interpersonal relations, and communication skills to address various mental health issues. The social intervention also used health education models, resilience, co-curriculums, and multi-components whole school programs to improve the mental well-being of adolescents. The program protocol of interventions conducted in schools ensured that the day-by-day uh, functioning of classes were not to be disturbed. At the same time, actually, we have taken our school, which we are running our own school. There we have taken samplings. At the same time, systems were put in place to see that students attended programs. The duration of the intervention varies across different programs, with some being conducted on successive days in each week to 1 month in a year. School intervention. Findings from the school based interventions indicate that more than half of the interventions were life and coping skills programs based for achieving positive mental health outcomes. Other interventions were carried out at the school that included peer education programs, teacher training programs, health education curriculum, and resilience curriculum. School mental health programs generally have been implemented on a limited and fragmented scale. Global evidence from a systematic review conducted in India, high income countries highlights the importance of teacher training and provision of ongoing support during the program implemented. Community interventions. School and community based interventions are more relevant to our program where there is a shortage of mental health professionals. But in this review, we found only one community based intervention conducted among adolescents, with one aimed implemented in rural communities settings delivered through peer leaders and the other delivered in an urban settings through trained teachers. The review showed that peer education was feasible approach, strength and limitation. The systematic review has some limitations which may have impacted the study due to the time and resource limitations. We investigated only scientific database and have not included grey literature studies. We searched for studies that were published in the last 10 years only. As conclusion, we observe a paucity of community and digital interventions addressing adolescents. Digital interventions, including mental health and psychological well being, can act as effectiveness means of delivering mental health information and services to adolescents, more so in COVID times. The platform can be way to forward for those in need or can provide primary prevention to those who at risk. There is a need for further research on mental health. Thank you so much.
I absolutely love that topic because mental health is, if not the biggest thing right now, is huge. And for adolescents is very, very vital and very important. So put your hands again together once again for Dr. Rosy Gundra.
The next award goes to Dr. Rosy Gundra.